Celeste, your host and publisher of Successful Black Parenting magazine. I want you to tell all of your friends and followers about this show. So go to our Facebook page for Successful Black Parenting and share the link with your followers right now and let people know you are joining us. Even better, you can click the options and start a watch party. I want you guys to start the watch parties, bring people in. You can comment on Facebook and I will post the best comments and questions live on air. And know that it can take a while for your questions to populate in the backstage area. So ask any questions early. Do not wait. Now, know that our hashtag for the show is BACKTALK. Last time we spoke with a pediatrician. Her name was Dr. Sylvia Owusu-Ansah from Children's Hospital of Pittsburgh at the end of January of this year about the novel coronavirus. She told us what to expect and what we need to do to keep our families healthy before the feds did. Now, today we're talking with another pediatrician, Dr. Jackie Doge, as an update to keeping your kids healthy during the COVID-19, also known as the coronavirus pandemic. And we will address some of these myths that are out there floating around as well. So if you have a friend who has been sending you those viral posts on your messenger on Facebook or on social media about whatever is going on with this coronavirus, if you want to educate them, tag them now, bring them into this chat, and let's talk. Okay, so welcome to Dr. Jackie. We're so happy to have you here.
Thank you for the invitation.
All right. Well, let's review for people who seem to not understand why this virus is different from the normal flu. Because, in the beginning I heard, oh, it's just a flu. Why are we doing this? Why are we doing that? Why are we in quarantine? Why? Why? So let's review. If you can tell our audience why this virus is different from the flu, and hopefully they'll understand what's going on.
Well, I think the basic difference is that they're totally different viruses.
Mm-hmm.
On the onset of the novel coronavirus, now everyone knows as COVID-19, very similar symptoms because we were in the midst of the flu season. So it was hard to differentiate if it was the flu or if it was coronavirus. But now that we are really sort of getting past the flu season, most presentations of the coronavirus, the fever, the cough, the shortness of breath, will more than likely be coronavirus because it's a community-wide spread now. I guess the other differences are that, again, I think it's just a new virus to it. It's just a new virus for us. Coronaviruses have been around for a long period of time, and they typically cause colds, but there are different types of coronavirus. This particular type, this novel coronavirus, is a little bit more causes more illness, more mortality and morbidity. More sickness and illness and death than the. Well, that's the thing. We don't have enough data. I was going to say more deaths than the flu, but we don't have enough data just yet to say in the United States it's causing more deaths. I mean, there are many deaths due to the coronavirus, but we'll see over time as we get more data in terms of how. I guess there is already data right now there from different countries that the mortality rate of the coronavirus is slightly higher than the flu. So that maybe is another distinguishing factor. And then the other thing too is the presentation. We're finding now too that they're aside from just the fever, cough, shortness of breath, shortness of breath, there are actually a variety of symptoms that people can have. And as we study more of the virus, we're going to find out that it's going to present differently based on age, based on person's risk factors, if they're immunocompromised or not.
Right. Absolutely. I've read different statistics from 6 times more deadly than the flu. And then I see a lot of different posts about people writing things like, oh, this many people die from heart attacks. This many people die a year from cancer. Why are we doing all this for this virus? And one of the things that I will respond with is that this virus has just got started. It just got started. So the potential of this virus to actually kill more people than all of these things in 1 year is very, very much a chance of that happening. So we don't want to think of it in mortality because we want to have a positive outlook on this whole thing. But this is the reality of it. People are dying, and we want to do what we can to protect our families as much as possible. So let's just tackle some more of those rumors that are out there because hopefully this will help people not get so many viral posts, because I remember at first it did look like from what we were seeing on TV, and now we know better, but it looked like Black people couldn't get it at one point, right? It looked like at one point it was only white people that were getting it, but we know now this is not true. Can you address that?
Oh, most definitely. I think the first cases of coronavirus, that you see on television, I think unfortunately television sort of sometimes defines our reality, right? Whether or not it's
Mm,
real or not. So I think there were, again, those are rumors that Black people don't get coronavirus. Because again, I think that was based on what was shown in the media, right? The media reports, you saw white people coming off the planes or
mhm,
traveling, right? And maybe some of that may have to do with socioeconomics as well, right? If you have, unfortunately in our country, right, communities of color are disproportionately impoverished compared to white families, right? And white families tend to have more wealth, so that may have influenced um, the thought and the vision of what the virus looked like. But as data is showing now, right, African Americans are disproportionately being impacted by the virus, and in many major metropolitan cities, Detroit, Louisiana, New
mhm.
Orleans, right? We can go on and on. New York City, Washington D.C., Chicago, African Americans are disproportionately um, infected and also dying from the virus. So,
Now,
so
go
it
ahead.
does. It affect. It's no discerner of person. It affects everyone. Everyone's at risk for this virus.
Now, part of me wondering. I know we have issues for like high blood pressure and those, diabetes and asthma. Oh, that are disproportionate in the African American community that can contribute to the symptoms being worse. But part of me has to wonder when I see viral posts going out of especially young Black people not paying attention or listening to, totally ignoring the quarantine and the stay at home orders that are out there. I saw groups in Georgia, especially in the Atlanta area, just gathering around like probably 50 people waiting in line for crabs to get like blue crabs, garlic crabs. And I saw, in New Orleans, we had Mardi Gras, and, people were coming together. We still have churches that are congregating, just people ignoring the social distance rules. And that definitely has to contribute, correct?
No, I think you're right, but I also want to kind of flip it a
Hmm.
little bit, right? Knowing that I think more people than not are really following those guidelines, right? And
Good.
I think for me, what's really been startling in this whole discussion of the health disparities, right? We
Hmm.
know as healthcare providers, especially providers of color, that African Americans, Hispanic Americans, Asian American, Native American individuals tend to have disproportionate health impacts, right? We have more chronic diseases. But again, it's not just because of the color of our skin or race. That has nothing to do with it. We know that it's a systemic issue, right? So
Hmm.
if you're more uninsured, you're going to have less access to a provider, right? Less access to testing. And then what about the concerns and fears of how am I going to pay for the hospital care if I even go to the hospital to get tested? So those are really important factors. And then getting back to your thoughts, you're in the mentioning of people still gathering. In some aspects, I think that there are not enough trusted individuals in those communities giving people the right and correct information, right?
Hmm.
So if you're only listening to people, or unfortunately you only have people that are not credible telling you information that's the wrong information, then unfortunately you're prey to your circumstances, right? Those particular circumstances. So I'm hoping, with your program, and other programs out there are more physicians of color, there are more physicians, period, even not physicians, right? People who are credible in the health field that are continuing to provide truthful, correct information, and information that will save people's lives.
I hope we can do the same thing. I just want to show people. I'm gonna try to see if we can get our screen shared here. I want to show people the numbers, and if you are, uh, if you can't see this because you're listening to it later, I'm just going to show my screen real quick. It says that the worldwide, we're almost at 2 million cases of coronavirus, right? Um, People are recovering. You see almost 400,000 people recovering. If we go to the United States, we're at over almost 500,000 people with this. 18,000 new cases over the last 24 hours, 20,000 deaths so far, which is just one of the highest numbers on here. Are we doing what is right? Let me just go to the USA, okay? So we can look at that and say New York is really going through it, you know. They have 180,000 cases. New Jersey, 58,000 cases. California is dropping on the list. We're now, that's where I am at 21,000 cases, almost here with Pennsylvania. So we have New York, New Jersey, Michigan at the top 3 with the most cases right now. Let me stop sharing that. That's Worldometers. If you want the source for that, you can go Worldometers. I think it's .info, and you can check out the statistics daily. They update them every 24 hours and sometimes ongoing. That's a lot of cases out there. Are these measures, are they working for our families? Like we have kids out of school, we have parents out of work, we have parents that were laid off work. Is this social distancing? Is it working? What do you think?
I think it is. I think it's an important step that we have right now, while we're waiting for other medications, the vaccination. So I think it's important that we do social distance. I think it's making a difference. And I think over time, right, you're going to see more positive tests as we test more people, right? So the more you're looking for something, right, the more you're testing for it, you're more than likely going to find more positives, right? But ultimately, as Dr. Fauci has said, and as other health experts are saying, that this is going to take a while, right? And it's really the virus's timetable. It's not our timetable. And a lot of measures that we're doing now, that we're putting into place, are to sort of, mitigate some of the impact, right? We want to mitigate the spread, so that because unfortunately the virus does spread if you're asymptomatic, right? So if you're not showing any symptoms, so staying home, even if you're feeling well, so that you don't risk exposing someone who may be at risk. So, let's go back a little bit. You talked about how people question why, only so many people are dying due to the coronavirus, and we have cancer, we have diabetes, we have other things that are killing people. But then I would then stop and ask that question. So are you telling me if we could stop cancer and decrease the death rates of cancer, we're not going to do anything about that? So
Exactly.
to me, that makes no sense, right? If people are dying, if your loved ones are dying, right, why wouldn't you do everything possible to assure that they stay healthy and live, right? So these are measures that we're taking. They're measures that have sort of been, the test of time. Pandemic of 1918, 1919, the flu pandemic. Studies showed that communities that utilized social distancing had decreased deaths due to the virus, and more people survived. I mean, it's going to take a while, but I think these measures are working. We just have to, and unfortunately, there is fallout from the social distancing, the economic fallout. We're seeing more of the gaps in our system, but I think these measures are working, and we've got to continue to do this to not only protect our loved ones, but also protect those on the front line, our first responders, our healthcare workers, those who are working essential jobs that are, serving us in the grocery stores, that are the custodians that are cleaning up after us. Like, I mean, we have to do this so that all of us will come out of this better than before.
Okay, we're going to be talking about some hard questions, some myths here, guys. If you're just joining, let's just address the comments that children are not getting COVID-19 and only old people are getting it. Can you address that?
I would say false. Okay, so just a simple answer. Kids are impacted just like adults are impacted. They may be impacted differently. Those that are immunocompromised, whether children or adults, right, are at higher risk for death and poor health outcomes from the virus. Most kids are doing well. Most adults, though, if they have immune compromise, they have diabetes, hypertension, they have renal disease, right, they're going to be at higher risk. And so they're going to have higher mortality, higher death rates. But children have died. There are infants who have died. There are young children who've died from the coronavirus. I was reading a story today where this woman lost her husband and I believe one or two sons, right? And they were fairly young, probably between 20s and 30s. So this does happen. So again, we have to go back to what can we do to as much as possible to sort of decrease the risk of us spreading the virus to other people and putting other people at risk.
Okay, we have some more rumors and myths to dispel. The coronavirus is caused by 5G towers.
No, I don't think that's true. That's not true.
No. Okay,
That's
okay,
not true.
okay. So I don't know how that came about. We know, I mean, we're still learning everything about it and where it came from. We do think it was originated in animals, correct?
Correct.
And
So
then it mutated to be able to transfer to people.
correct. And that's how a lot of viruses do spread. They start in an animal host and then go to a human, and then there's human to human transmission of that virus.
Okay, okay. And here's another one. Hot air kills the virus. Like people are putting blow dryers up to their nose and inhaling deeply and
I would say don't
drinking,
do that. No,
drinking hot liquids. They said that. So go ahead, say what do you want to say about that? Go ahead.
So I would say no, that's harmful, right? To put, hot air up your nose. I mean, if you need humidification, right? So if you have nasal congestion, right? A humidifier may help relieve that nasal congestion, but that doesn't cure the virus. Your body, it's going to take time for your body to sort of fight off your own body's defenses to fight off a virus. Regarding hot liquids are more so, I think, a treatment for you have sore throat, right? Sometimes warm liquids will help kind of decrease the irritation and pain from a sore throat, but it doesn't cure the virus. Because I think, put it this way, I look at it this way: if these things actually worked and they cured it, we'd be done, right? We wouldn't even have this conversation. So no, they are remedies to help other symptoms. It doesn't cure the virus.
Right. And, I think that came from, I saw about this hot air and the blow dryer that the virus lives somewhere in here, but that's not true. It lives in your body parts, like your lungs. It wants to get to your lungs, correct? Bloodstream. How does that work?
Well, the virus does, there are viruses in the nasal and the back of your throat, because hence the being able to spread the virus via droplets, right, through coughing and sneezing. Then the virus does spread, can go into your lungs and then disseminate throughout your body as well.
Okay. Okay. So that's the nasal droplets. Okay.
Yes.
Because that's where that came from. So another rumor, it's a man-made virus to reduce the population. Can you trust a little bit about that?
I do not think that's true because I don't think that's true. That's the only way I can say, right? We know there's a science behind other viruses. Coronaviruses have been around for a long period of time. This is another type of coronavirus. So the science doesn't bear that out.
Now, this is another one, and it can go both ways, but not as many people are dying as they say they are. However, I'm just going to say something before you answer that. I've seen this put out there, and there was a reporter that also found that in their area, at the I guess the city morgue, they were listing more deaths as upper respiratory failures and pneumonia that weren't listed as COVID-19. And there was a spike at that particular area, 41%, that weren't being identified as COVID-19 because many of them were dying at home. So there's also a possibility that not everyone is being recorded as dying from COVID-19. But that's the rumor now. There's not as many people are dying as they say they are.
I mean, I think there might be some truth to that, right? We don't have all the data. Depends on who's tested and who's not tested. If someone died at home, unless there's an autopsy and testing is done, you're not going to know if that death was COVID related or not. So the data is really based on the number of test results that we have. So
go
ahead.
Go ahead. No, do you know if a person is tested and they die before getting the test back, if they are then listed as, do they change their death certificate in that case? Do you know that information?
That I don't know.
Okay. I was wondering about that. All right, let's talk about masks a little bit, because in the beginning it was like, don't wear a mask, it won't do anything. I have asthma, so I've been wearing, I actually self-quarantined a week before it was mandatory. And for just watching it from China and seeing it starting to come here, I just automatically self-quarantine, start wearing a mask. And people were saying, oh, that mask won't help you, it won't do anything for you. And it just so happens that I've had N95 masks for many years, but I, a bug out bag, just in case anything happens here from earthquake going down. So I have had them, and I wear them because I know how to seal them. I know how to take them off so I don't contaminate myself. I know not to touch them while they're on my face, and to wash my hands before, after, etc. I learned all that on my own, but I had to wear it. So I would get so much criticism when people would see me, and almost dirty looks when I was out. Will masks protect you? Will it not? Will it won't? Will it not? And why are they telling us now to wear masks when they didn't tell us before?
Okay, so those are good questions. In terms of the mask now, the mask really, when we wear our face mask, we're really protecting others from getting the virus versus protecting us, being protected from someone else, right? So each of us putting on a mask, we're protecting. We're not going to spread the virus to other people. And I think some of the discussion about face mask or not to use face mask really was also due to the shortage of personal protective equipment for our healthcare workers, right? So kind of having to balance. I see personally, right, balancing, right, protecting our first line, protecting needed equipment for our first line responders, and then also the public. But as data, more science is available, there's more interventions that can be proposed, right? And hence the face mask. But we don't have people who are not healthcare workers or first responders that can use cloth face masks, as opposed to the surgical face mask that we really should be reserving for our healthcare professionals and first responders.
And I agree with that 100%. And if everyone wears a mask, basically keeping your own germs in, we don't have to worry about you spreading it to someone like me that has asthma, correct?
Correct. But I would also say, right, just having a face mask is not a reason to oh man, my brain is so slow today, to not stay at home, right? So, and not to social distance, right? That's one tool in the toolbox. So we wear our face mask for essential things that we need to do, and we social distance, and we stay at home when we can stay at home.
That's absolutely right. And so what else can we do in addition to hand washing, to protect ourselves? I know a lot of people have external things coming into the home. We were talking about packages. We know that people at Amazon are sick and they're packing your Amazon boxes. We have people still doing food delivery. What can we do? Is there more to do than hand washing and staying home or wearing a mask? Or is that about it? Is that all we can do?
I mean, the other things we can do are making sure that we frequently clean surfaces that are touched, the doorknobs, right, the faucets. I think we become, if you weren't a cleaner before, right, you become a cleaner now. Also, too, I think we forget about like just the basic things to keep ourselves healthy. What's our sleep hygiene? Right, are we getting to sleep on time? Meditation, right, our mental health, right, that also. It doesn't protect us from the virus, right? But it's gonna help keep us uplifted, right? Keep us present so that we can be with our family members. Other things that we can do are like sometimes healthcare workers, what they're doing is, or if you're out, some people are changing their clothes. So as soon as they come into the home, right, they're changing into another outfit, as opposed to wearing the same clothes that they were out in and washing those in warm water. And I think, again, those are some additional things that we can do. Other things we can do is if we feel ill, right, we need to contact our healthcare providers if you have a healthcare provider. And then, maybe also if you can, right, separate yourself from the rest of your family while you're trying to figure out if you are ill or not, or you have COVID. You may have to just presume that you have coronavirus just because it's community widespread. But if you can, separate yourself from the rest of your family. Don't visit other people. Again, the social distancing. So those are some additional things that people can do.
Okay. Well, hand washing is always been a big one, but I can tell you we've washed our hands so much that many of our hands are cracking and it doesn't seem to be enough hand lotion in the world to fix it. And we're teaching our children now to wash their hands better because to the ABC song, sing the alphabet song while you're washing your hands and things like that. So all that is helpful. This virus, though, it doesn't seem like it's going to go away. Listen to Dr. Fauci talk about this, that we will be dealing with this for about 18 more months or until a vaccine or herd immunity happens. Well, can you explain herd immunity and why this isn't over until it's over to our audience?
So the herd immunity basically is if there's a certain percentage of people who are protected from the virus, in this case, the coronavirus, right, then so it has to reach like a certain number, a certain percentage of the population, right? So once that percentage is reached, then the likelihood of it being spread, right, to other people, it dampens. And so we're really protecting other people. The vaccine is really going to make a difference for us, right? And this, in terms of protecting more people. And then we'll have to see over time, right, with the vaccine, how long the immunity from the vaccine lasts, or even how long the immunity from being exposed to the coronavirus is. The data is still coming in. The science is still being developed regarding that.
Okay. Marcy just commented. She is a healthcare person. Let's see, what is she? Primary care NP. That's what she is. Thank you, Marcy, for commenting. She said people who don't have PCPs can contact local health departments or other FQ headquarters as well. So I'm going to just put this up here so you can see what she said. Thank you, Marcy. Now, our children have to go back to school in the fall, it looks like. We're going to play it by ear, but just assume they will. How do we keep them safe if this isn't over? It's not going to be over until we have a vaccine or herd immunity.
Oh, that's a very good question. And I think those plans are slowly being developed. I have colleagues of mine who are also pediatricians that are school docs, and they're already working out ideas, right? So, but I think those plans are still in development. I think we're going to have to weigh the fact that not everyone is going to be immune to the virus at that point. We won't have the vaccine at that point. So we'll have to weigh how the social distancing is going to be done in school systems. Are kids going to be wearing masks in schools? I think there are a lot of things that have to be thought about. Are there going to be sporting events? How a nurse is going to be taking temperatures for kids coming into school, symptom checks. So those things are going to be interesting to really kind of figure out. But we are thinking about that, and plans we're planning now how we're going to do that.
Yeah, because normally it's difficult for children to get released even to go to the restrooms, because teachers know they play around, so they restrict them from going to the restroom. So a vigorous hand washing routine in school or being allowed to wear a mask doesn't seem like that will happen. But however, we're entering a new normal, right? So it could change, like you said, with all the different plans. So COVID-19, let's just talk about the little dark side of this a bit. It's a vicious virus. The way it fills your lungs up with mucus, and it's a lonely disease as well. So if you get it, you got to be quarantined, but you go to the hospital alone. You get no visitors. Your loved ones can't come, and a lot of people had to die alone because of it. It's a very lonely and vicious disease. So that scares parents. It's very scary. And so what can parents do if their young child or baby come in contact with the coronavirus and they have the symptoms? They can't isolate their child. And there's no way a parent will stay away, especially with the horrible symptoms that patients experience, like the rigor chills, right? Chills. And what's a parent to do at that point when you too will be exposed? Is there anything you can do, or you just have to hope for the best?
I think there are things that parents can do. I think definitely wearing the cloth face mask are one things that caregivers can do in the house. Also, again, it depends on the circumstances, right? A lot of the recommendations tend to skew towards people who have the means, right? Who have multiple bathrooms, have multiple bedrooms in their houses, right? And places that they can sort of isolate the person who's ill from the rest of the family. But as much as you can, you can things like again, the cloth face mask, reinforcing hand washing, for the family member that's ill, using separate silverware. Okay, you want to keep the things that they're using, in terms of serving them food, the forks, the knives, the plates, the cups, separate from everyone else, right? And once they're done, you want to wash those in warm, sudsy water, right? Keep those things separate. If you only have one bathroom or have access to one bathroom, then again, making sure that frequent cleaning, with using the Clorox wipes or the Lysol wipes, right, to make sure that those surfaces are cleaned before and after that family member uses the bathroom. And then, as much as possible, again, rest. Trying to stay as in touch with and present with your family as possible. And then if you feel ill, you also have to take care of yourself. But sometimes I know it's difficult, right? If, again, depending on the family circumstances. So as much as possible, the hand washing, face masking, keeping things separate, doing the laundry separate, and probably doing that more frequently, probably for that child that's ill. And if their symptoms get worse, if they have a healthcare provider, contacting their healthcare provider, possibly through, a lot of providers now are using telehealth, right? So that you're basically video conferencing. Mm-hmm. And if they're really worse, then they might have to go to the emergency room, right? So for additional care, but also making sure that when you call 911, that they're also aware that the child may be exposed or may be diagnosed with coronavirus, so that you also protect those first responders and the hospitals aware so that they can prepare.
That's so terrifying as a parent to even think about that. And I know our resident toddler, which is my granddaughter, so I'll call her our resident toddler. She is terrified of the mask, that when she sees it grown, she doesn't understand. So how do you, as a doctor, a pediatrician, especially when you wear a mask around your patients, make them feel comfortable with seeing you with that mask?
For me, it's a little bit easier because I work primarily at a local health department, and mm-hmm. the patients that I'm encountering, they're coming in either to the facility, or if I'm going out to visit a facility, they're already aware that we need to wear the mask. But I think some other things that can help as well is, as a parent, just reassuring your child that, why they're wearing a mask, right? It's to protect you. And if you have to wear a mask, it's to, it's a form of protection, and it's something that you can do to help someone, right? And maybe kind of reframing the conversation. The other thing too is, if your child is wearing a mask, maybe decorate it, right? Especially if it's a cloth mask, make it fun and creative, and help you create that mask so that they have a sense of ownership of that mask. So, but again, also reading books and showing stories about how doctors and nurses and other healthcare professionals are really working, right? That mask is a tool. It's almost like Superman's cape, right? Or Black Panther's talons, or his suit, right? That those are ways to help keep you safe and protected. And I think that may help with kids as well.
Okay, that's really good advice. I like the idea of decorating the mask. Even if they're sick, it seems like they have kind of an eye of the storm during the daytime. And like Chris Cuomo said, when he's going through it now, that the beast comes at night. It seems like that seems to be a common thing with flus in general, that it gets worse at night. So perhaps if they're feeling well in the daytime, they can help you decorate the mask so that they know that it's part of their ownership, that they helped to create it. I think that's a great idea. Just to talk about the Lysol and Clorox wipes, I got to tell you, they are almost impossible to get. So we have to start making our own, bleach solution and paper towels, which are also hard to get. You may end up having to use a rag or washcloth that you sanitize, but it's so difficult. I saw Lysol being price gouged on eBay, $40 for one can. Yeah, and they're bidding, and the bids are going up and up and up. And Clorox wipes are difficult to get. If you're lucky enough, you can catch them at the stores, depending on where you are. But if you're stay-at-home orders, and especially during the apex, which some of us are experiencing, they're actually saying don't go out to the grocery stores right now or pharmacies, because we're at the apex of the curve for coronavirus, and they don't want it to keep spiking. So you talked about this earlier a little bit. Let's talk about the most common symptoms of this COVID-19, also known as coronavirus, and some of the symptoms that have been also noted, so that our listeners can be aware to protect themselves. Like, what are the most common? And let's go down the list of what else might not be so common, but other people are reporting on.
So the most common, fever, cough, shortness of breath. Some people may even experience sore throat symptoms, or what might be, you might think you have an allergy. Some additional symptoms that haven't been The most common symptoms, but that have been reported, some people have lost a sense of taste. Some people may have GI symptoms. But then again, you know, I think the science is evolving in terms of presentation. I think in those that are elderly, the presentation might be slightly different as well, right? So you may not spike 102 fever, but if there's a change from baseline, then those might be indicators that they could have been exposed or may have the virus.
Great. Asymptomatic people, explain what that is and why some of them aren't getting it, and then why some are asymptomatic, but then get it later. Can you tell us a little bit about that?
So asymptomatic just means that there are no symptoms, right? There are no discernible symptoms that you have the virus. Like you don't have the fever, you don't have the fever, you don't have the chills, you don't have the cough. But we're finding from the virus is that, or a lot of viruses, there's an incubation period, right? There's a period of time that there's a risk for exposure and you developing from the time that you may have been exposed to developing symptoms. And again, as the science has evolved, we're learning from other countries' science and even from the United States that with this virus, you can be infectious, right? So you can spread it before you even start to show symptoms. But it's very common to the flu, right? You can actually spread the flu before you actually develop the symptoms of the flu. So it's not so this isn't a new process for viruses. It's just trying to figure out what period of time are you most at risk for exposure. And right now, the risk of exposure that we're finding right now is, so if you're exposed to someone who has symptoms and has been diagnosed and has symptoms of the novel coronavirus, we've been thinking 2 days before they even presented with symptoms could be that time, that's sort of the start of the window, right? And then from exposure, probably the average time that people will start to show symptoms like 5 to 6 days, but it can be as far out as 14 days from the time that you actually were exposed to that person. But the science is evolving. And I think, again, just reiterating the importance of, if you can, wearing a face mask, so that if you're around other people, that you don't spread the virus unintentionally because you're not showing symptoms at that time. And then everyone's different, right? Everyone's physiology is different. So some people, their immune system at the time, I guess, is like robust, so they're not showing symptoms, or the symptoms aren't as bad as another person's symptoms. So it's going to be individual based on the person, based on their health risk, their disease state, so to speak. It's going to be individual in terms of a presentation for each person.
Okay. And I've seen after they've had the virus, a lot of people are still weak with fatigue, or some people who've been on ventilators really have the after effects of the ventilator. And I imagine, they're out of breath. They're saying that one guy who's an athlete has to use a stool in the shower after he's got off the ventilator. I imagine they have to go through some sort of physical therapy to build their lung capacity back up. Is that what we're finding with most respiratory infections, that people will have to go through some kind of therapy later? Or is this permanent?
I think it depends on the person, right? A ventilator is a little bit different, right? You're having, air, pressed into your lungs, you're intubated, right? And so there's some other impacts to the intervention to help you breathe. And then plus you've been out, you're laying down for a period of time, you aren't using your muscles. So that's going to take some rehabilitation. But most people who are not hospitalized, who have not had haven't had a ventilator, right? Depends on, most of them are recovering well. It may take them a little longer because, if you've had a high fever for a few days, you're not going to feel well, and it's going to take you a while for your body to come back to normal. So I would just say, just let it run its course, right? Rest as much as you can, and take that time for yourself so your body can heal, so that you can be back to normal.
All right. Okay. So I remember having the swine flu years ago when it was going through the communities, and I honestly don't know how I got it. I remember being on the couch for 2 weeks thinking I literally was going to die. Too weak to want to move to go to the hospital, and too weak to wanting to move to go to the bathroom. So if this is anything that's close even to that, I still can't imagine what people are going through. But
But I know there are individuals who are sharing their experiences. I
mhm,
mean, there's some celebrities and non-celebrities that are
mhm,
sharing their experiences either with their loved ones or themselves. So I think those are important to kind of hear their stories, right? But
mhm.
again, it's going to be individual. You know,
Right.
you may have those effects, you may not have those effects. I just think, to be as informed as possible, I think is most
Mhm.
important.
Yeah, some people have just mild symptoms and
Yes,
they
yes.
recover. So let's just talk about the quarantine because the quarantine is just not for the virus to go away because we talked about it's going to be around for a while, but instead to limit the population who gets it to not overwhelm the health systems, right? So it's predicted that 70% of us, and hopefully it'll be less than that, will get this virus over the next year. However, the government keeps seeming to play with the idea of getting people back into the population to work, which people need to work. I get that. But especially concerning the antibodies to the virus, because now we're hearing that people in countries like Korea and Japan and China are experiencing reinfections of the coronavirus. And that is often worse than the first time they had it. But so, in other words, you can get this virus more than once, it looks like. And we know everything's new and the science is new. But my question is, then how can we send people back to work and our children back to school if this is the case? Because they're talking about testing for antibodies. Even an antibody card has been floated around. Um, it, like you said, people are planning, and we want to know if it'll be safe to send our children to school. But how can we create a vaccine if antibodies from this won't protect you from reinfection? That's my concern. So they're working hard to get this vaccine. But what if it doesn't protect us because people can get reinfected? Can we get reinfected with other flus? Like, could I get swine flu again?
There's a chance, yes, right? Because with the flu, there's different strains each year, right? And so
Hmm.
a lot of the vaccinations that are provided for the flu, right? They use the science, like, another hemisphere. What are the most common types of flu, right? To prepare for, will that be the same circulating strains of the virus for the United States, right? For the northern hemisphere. So they do their best work in terms of like what's the most common viruses, but there are always new viruses emerging, right? So, and that's why I think it's so important that our scientists, our virologists, our immunologists, right, our healthcare people are really working hard to find and trace any sort of new iteration of a virus. The vaccine, that's going to take time. That's why it's going to take 12 months to 18 months, right, to really get it right. There's going to be multiple testings. There are going to be human trials to determine immune response, and then that'll be expanded. So hopefully we do have a viable vaccine. And then over time, there's still going to have to be science, continuing science and continuing research about that vaccine for the coronavirus, for COVID-19, to make sure how long the immunity is going to last. So I think you're right. It's just going to take time, and we don't know yet if people will get reinfected or not. I think that's where the antibody tests are coming into play, to determine who might be immune and not immune. But again, there'll need to be more research and science to find out how long that immunity does last.
Right. Okay. So, what else do our parents need to know to protect their families? What do they need to know?
I think first and foremost, it's important to look for reliable information about the virus, right? So the Centers for Disease Control, I'll do a shout out to the American Academy of Pediatrics. I'm a fellow of the American Academy of Pediatrics. I think those are important. If you have adults who have other healthcare providers, the AMA, Family Practitioner Association, right? So you want to have reputable sources. Also, the Nurse Practitioner Association. The other piece too is, I would say, this is going to be a while. Okay. So I would say limit media, right? You don't have to have the, the news on every day, 24 hours a day, coronavirus, 24 hours a day, right? Because even for me as a healthcare professional, it's too much, right? I'm getting stressed out. I get
Hmm.
anxious, right? Hearing the data, hearing the deaths, right? And I try as much as possible, even with my own family. I have older kids, right? They're teenagers. Actually, they're adults, 18 and 21. They're
Hmm.
adolescents. But again, when they ask questions, I try to reassure them as much as possible. But that reassurance is based on credible information. And I hope I have credible information, right? Because they're asking me knowing that I'm a healthcare provider.
Hmm.
And I think the other piece too is, as negative as the coronavirus is, as 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 much social disruption that is causing, I think as much as possible, try to find, if we can, right, try to find the positive out of the experience, right? And I think we're seeing that. We're seeing people being very, kindness coming out. I mean, of course, you see the negativity, right? But I want to focus on the kindness. I want to talk about the presence. Family members getting together, right? So I'm missing my maybe it's tomorrow because it's Easter. We're going to have family Zoom times, right? I think we're gonna Easter dinner together, but do it remotely. Everyone in their home with their Zoom camera, and I'm already thinking about what I'm going to make for dinner tomorrow, because I guess it can't just be macaroni and cheese from the box. But again, it's just really, it's like, togetherness. I think that people are making face masks, right, for other people. They're buying groceries for their neighbors. Just really getting in touch. I think people are also, this is a great opportunity to talk about the importance of mental health, especially in communities of color, especially Black communities, right? I think this is a time more than ever, right? We got to really talk about anxiety, depression, and what we can do to sort of mitigate those things. And just being one, and and even the innovation and the excitement that can come out of the possibilities of the coronavirus. But I know that there are people who are being harmed from this virus. So I don't want to dismiss that. But I think there are also opportunities to find something positive out of it, and stay present and stay involved, and help each other.
Well, thank you for that. I think that is wonderful advice, because, like you said, it can become overwhelming, and not watching the news every day. Sometimes you have to disconnect from social media, whatever you need to do to maintain your mental health. So I appreciate that. And I can see that one of our listeners put up a question about any tips for maintaining our mental health. So turn off the social media, turn off the news for a while. Is that what you suggest?
Yes. And then other things that are great are, walking outside, right? If you have an opportunity to take a walk with your family, again, maintaining social distance from other people, nature is really important. Exercising is important. And it doesn't just have to be lifting weights, right? You can just, put on the music, right? Whatever tunes you like, and jam out. I know Instagram, they have dance parties, turn on the music and start dancing together. I think those are important. And the other piece too is, if you're seeing changes in your child, or even yourself, right? You're feeling, problems sleeping, restless, losing weight, not eating, sort of withdrawing from your family or activity, right? Reach out for help. There are many providers, mental health providers, that can provide resources to you via video conferencing, talking to your child's pediatrician, talking to your primary care provider. I think getting help is important, and even more so now, so that as a family you can stay intact and be available for them, and also be available for yourself, so that you can make it through this.
Okay. I do see one more question that's off the grid here. How young can children, or should they even, wear masks? Because we're seeing on these ads on Facebook and social media, pacifiers with masks built into them. That doesn't seem safe to me. However, they're not tight, because they can't be tight. But I mean, how far down this rabbit hole do we go? Like, do our children need to be covered up if they go out for like a walk, for instance? Because they shouldn't really be going anywhere in public, correct?
Correct. I've seen some places that the recommendation is not to wear a mask under the age of 2 years of age. Mm-hmm. So I'd say if you have really small children, it's probably better, like, infants, probably the parents can wear the mask, right? Older brothers and sisters can wear the mask, and as much as possible, hand washing. And then hopefully, if you're social distancing, right, you're not having family members coming over to visit the child, or you're not taking your child out to visit others. But I think it's okay to go bike riding. You don't need to wear a mask to go bike riding outside. I think we need to create some sense of normalcy for our kids. So I think they should go outside and play. They come inside, have them do the hand washing after coming from outside. If you have to go to the grocery store, if you can, I wouldn't take the children with you. Maybe have one designated person that goes to the grocery store and comes back, and that they wear their face mask when they go out to the grocery store.
Okay. Well, I know here in LA, they made it mandatory in some of the areas that you have to wear a mask in, let's just say California, in different cities. So that's really, I think it's important to cover your face so that we can keep this contained as much as possible. Dr. Jackie, I just want to thank you for coming on our show today to talk about this subject. And all of you who participated, thank you so much. Thank you for your comments and your questions. And for listening to Back Talk by Successful Black Parenting, the podcast talk show for parents. Now, if you missed part of this show, no worries. You can just wait a few minutes and click the replay of this podcast. It's also available. It will be syndicated, so you'll be able to get it on everything from iTunes to Spotify. Share it with anyone who needs to hear it, and let's get the word out. During the quarantine, we are having limited broadcasts, but I'll get back to you with a regular schedule soon. You can go to our Facebook page at Black Parenting One and sign up for the notification so you don't miss when we go live again. One more thing, don't forget to follow us on Twitter and Facebook. Instagram, we're at Black Parenting Magazine. Everywhere else, we're Black Parenting One, for the first Black Parenting magazine in the nation. Our website is successfulblackparenting.com, and it's full of good content to help you thrive and not just survive as a parent. Be sure to rate our podcast. And until next time, take care of yourself and stay safe out there. All right. Take care.